I'm going to start off by comparing my doctor's orders to my MAR. And it says here that the patient's name is Janet Green, which is correct. The medication that I'm giving right now at 8 o'clock is gentamicin. The dose I'm giving 80 milligrams, and the route I'm giving IV piggyback. It's going to be every 8 hours, and the time is now. I'm looking up for allergies, and she says here that she's allergic to penicillin. Okay, and she also has the 5W hanging in the room. So, all right. Now that I've checked that, I'm going to compare my medication to my MAR. All right, comparing it, and then I'm also going to look for clarity in the expiration date, which is it's in date. So, okay. Now that I've done that, I'm going to look and see if that's a safe dose. It says here my patient weighs 180 pounds. And here it says the usual dose is 3 milligrams per kilogram every 24 hours. And just to say my patient weighs 180, that's 81 kilograms, and that would be 81. So that's a safe dose. If 81 is a safe dose, I know 80 is. So the dilution, okay, it says further dilute each single dose into 50 or to 200 milliliters of normal saline or D5W, which I know that is correct. Okay, because my book states, and then also I know it's compatible already because it says here that I can mix it with D5W. The rate of administration, it says each single dose properly diluted over 30 to 60 minutes, which I'm going to use 60 minutes because it is the safest for my patient. And now I'm looking at precautions. I'm going to monitor their peak and trough levels, BUN and creatinine, their electrolytes, calcium, sodium, potassium, things like that. I'm going to tell them to report any dizziness, diarrhea, or any muscle spasms or weakness and fatigue. Okay? Now that I know it's a safe dose and it's diluted correctly and they're my rate and it's compatible, I've already done my drug problem and I come out with 8 drops per minute. Okay. Alright, I'm going to gather my equipment. I'm gathering my equipment. I'm going to wash my hands. Okay. I'm going to label my solution. It says here I have 50 milliliters of D5, so I know that is correct. And there was 80 milligrams added. And there's my label. I've got my name, patient's name, my initials, what I'm giving, how much it is, and the time, and where it's mixed in. Okay. I've already washed my hands. Okay, I'm going to clamp this off. And go ahead and swipe my bag. Now that my bag is white, enter sign in the chamber. Going to slowly open and prime. clamp it back. Alright. Now that I've got my medication prepared and my tubing primed, I'm going to take my medication, my swabs, and my MAR to the room, and my hand hygiene. Now that I'm in the patient's room, I'm going to say my name is Hannah. I'm the nurse taking care of you today. Today I'm going to give your antibiotic to you, okay, and it's gentamicin. And then I'm going to ask the client to state the name and date of birth. After she's done that, I'm going to ask for allergies. It says here that you're allergic to penicillin, is that correct? Okay, you have any other allergies? Now that I've done that, I'm assessing the site. There's no redness, swelling, inflammation. Okay, and it's infusing. And I've got D5W, as the MAR says. I'm dropping the bag to see if I get blood return, and I do. Okay. And I've also got my hanger. Okay. And now that I have assessed the patient, I'm going to be saying I need you to report any dizziness. I need you to report any diarrhea. And any bloody stools and things like that, and report any muscle spasms. Alright, now that I've explained the procedure and I've got my medication right, I'm going to drop this bag. I'm going to lower the primary. If I can. Let's see. Where's my time at? It's a little low. Okay, now that I've lowered the primary, I'm gonna wash my hands. I'm gonna wash my hands when I come in the room. Okay, and now I'm going to close the port, which is going to be closest to the bag. For 15 to 30 seconds. Okay, let that dry. Okay. Make sure it's clamped off. Make sure this is clamped off. Okay. Unscrew that. Okay. I'm going to open this all the way up. And I'm going to control it with my primary. Now that I've done all my safety measures, I'm going to start counting my drops, which is 8 drops per minute, which I'm going to get 2 drops in 15 seconds. Okay. So that was 2 drops within 15 seconds. Let's see. You zoom in. Okay. Now I'm gonna start counting my full minute. Two.
But not actually do anything, just say what I'm doing.
3. 4. 5. 6. 7. I'm at the where's my time?
11:45.
Okay. Make sure it's right. Count my full minute again. Three. 4. 5. 6. 7. I've got 8 drops per minute, and that is within my 1 minute time range. Okay, now I'm gonna let that infuse. I'm gonna go document. Make sure the patient's tolerating it well. Are you feeling okay? You have any dizziness? Okay. All right, I'll be back to check on you. Make sure the bed's lower, and then I will come back, wash my hands again, and make sure the patient's doing well. Monitor the site. Okay, make sure I have the right patient. All right, now that this infusion is done, I'm gonna clamp this all the way down. I'm gonna unhook this. Okay. Take this down, dispose of it properly. I'm going to raise my primary. And I'm going to set it back to the normal infusion rate. Okay? Now that I've done all that, I'm still going to assess the site and tell the patient to report any dizziness, diarrhea, or muscle spasms. And I will be checking on the patient frequently. That's set back to the normal infusion rate, and now I'm going to go document.